He recommends psychotherapy and medication. He tries a medication to help, but the patient, our gentleman, complains of a lot of side effects and worries that the medicine is too strong or too dangerous. Now that's extremely common. Why is that? When you have panic attacks, like I said, you start to get really in tune to your physical body, to your physical symptoms. Every little twitch, every little feeling in your body, you're in tune to. You're hypervigilant to all your physical symptoms, right? So if you have, a lot of medicines will cause dizziness, or they'll cause lightheadedness, or headache, or upset stomach, or something like that. If you have any of those symptoms at all, those are all sort of things you can see with panic attacks, right? Well, these folks, and with good reason, they'll have a symptom and it'll scare them, and then they'll have another panic attack, and so they associate, hey, this medicine caused me to have more panic attacks. Sometimes it could be the medicine that does that, but a lot of times I think it's more the fear of the medicine, or the fear of the symptoms, that the medicine causes. So this guy is classic. I mean, this is why I sort of made this case up like this. But he starts doing psychotherapy. Okay, so he has a psychotherapist, and the psychotherapist teaches him a lot about the illness, and he learns some ways to diffuse the anxiety through his behavior and through his thoughts. And we'll talk about that in a second, what kind of things you can do. And he learns some relaxation techniques. Okay, through doing all that and sticking with the medicine and working with the psychiatrist, he's able to stay on the medicine long enough, and gradually, over the course of 4 weeks, and then 8 weeks, and then 12 weeks, it takes about that long for full effect, but he starts to go down, and the severity and the frequency of these panic attacks drop slowly as time goes on. He now is having a panic attack about once a month, and it's much milder. Okay, remember he was having 3 to 4 a day? Now he's having one a month. Okay? Take-home message here is that sometimes you don't completely get rid of it. It's a brain illness. It's sort of like, I don't know, diabetes or something. It's going to fluctuate. There's going to be times where your blood sugar is worse, even if you're the best person at watching your diet, and taking your insulin and all these things. Still, sometimes your blood sugar is going to get the best of you, right? Same thing with this. It's an illness. You're not curing it with these things, but you're certainly improving it. So if you can go from 3 to 4 panic attacks a day to 1 a month, or even a mild one a month, that's pretty good. I'd say that's pretty good. Most of us would say that. I think sometimes folks have expectations that it should be completely gone and there should be no more problems ever. So now this guy is able, because of this, he's able to go into stores and drive again. And now when he feels a sensation of a panic attack coming on, or some physical symptom that reminds him of a panic attack, he's able to control his thoughts and do some relaxation exercises, and it keeps him from having a full panic attack. Not that he never has a full panic attack, but it's just a lot less frequent. So what is all this psychotherapy I keep talking about? Let's talk about that first, the treatment of panic disorder. Has anybody ever heard of cognitive behavioral therapy, CBT? It's a fancy, big bunch of fancy words. Let's break it down. Cognitive, what does it mean? It means thinking. It means your thoughts, okay? Behavioral, we know what that means, right? It's how we act. It's how we behave. And therapy is therapy, okay? So CBT has been studied over and over again for all these anxiety disorders we're going to talk about, and also for depression. And it's one of the most effective psychotherapies around. What does it do? A lot of things happen when you have a panic attack, okay, or when you have panic disorder. First of all, we talked about the fear of fear, right? That's a thought. That's a thought process. You're afraid of having another of these panic attacks, right? If you start to have a high, your heart rate starts to go up again, or something like that, or you get dizzy, and you start, what usually happens with these folks? Well, you start, like I said, ruminating about, oh my gosh, is this another panic attack coming? And the more you ruminate about that and worry about that, boom, you throw yourself into one, okay? If we can teach you that dizziness, that heart rate going up, that the panic attack in general is not dangerous, then sometimes you can stop and think, okay, now the therapist taught me, or my doc taught me that this isn't going to kill me. If it would have killed me, then the hungry lions and all the stuff about the lions and dropping dead in front of the lion, and you can smile a little bit and go on, and you don't have a panic attack. That's one sort of mental trick, I guess. Behavioral part. What's the behavioral part? In therapy, one of the things that we teach folks is that with any kind of fear, and this will make sense to you guys, any kind of fear, the more you expose yourself to it, the less fear you have. Has anybody ever had like fear of heights or something, and then they had to do a job up on a roof? I mean, I had that when I was a kid. I was kind of scared to get on a ladder. Next thing you know, I'm up on the roof working this job, right? I'm hanging over this roof 30 feet down, just pulling stuff up over the roof. It's like nothing, because it took me a while, but after a while of doing it over and over again, you're not as afraid of it anymore because you did it and nothing bad happened. Same with flying in an airplane. A lot of people, oh my gosh, I'm going to die if I fly in an airplane. I'm sure there's 50% chance this plane's going to crash if I get on it. I don't think so. I mean, the odds are probably not that high, right? I mean, otherwise, half of the millions of people that fly every day would die, and we'd all hear about that, I assume. So it's very unlikely. But the more times you get on a plane and nothing bad happens, the better off you are. So same thing with any kind of fear. Fear of spiders, any of that stuff. The more you kind of get around it and work with the fear, the better off you are. So one of the things you can do, and this is kind of an interesting thing, but let's say that dizziness and this is a real story. There was a therapist, a cognitive behavioral therapist, that trained me at IU, and she was very good. She would bring folks with panic disorder in, and one example she would use for us when she was teaching us is a case that was a person who had a lot of dizziness and lightheadedness with their panic attacks. Okay, so she worked with the person for a while, and it wasn't immediately that she did this, but she brought them into their office, set them in the office chair, desk chair, and spun them around in the office. It sounds like torture, right? Well, she wasn't really torture. I mean, she was getting them to feel dizzy and getting them used to feeling dizzy. And then while she was in the office, if they started to have a panic attack or something else, she was able to work with them and get them to not have the panic attack. So the more times they got exposed to that dizzy feeling, the less likely or the less fearful they were of it, and the less likely it was to throw them into a panic attack. There's a lot of things you can do like that. You can have somebody, come into your office and you can run up and down the steps with them, or walk up and down the hall real briskly, and it gets their heart rate up, and then they have to kind of get used to that feeling of the heart rate going up, and it's okay, I'm going to be okay. So these are behavioral things you can do. As you can imagine, if you can learn some of these things, basically you have this then, right? Unless you develop a memory disorder, which we already talked about those, so I won't go into those today. But as long as you can remember something going forward, then you can take these little things, these little tricks with you, and it basically helps your outcome. You do a lot better with not having as many panic attacks. When it comes to medicines, you guys you've heard all about all the serotonin medicines, I'm sure. The Prozacs and the Zolofts and Lexapros and Celexis and all these. They work on the same chemical system in the brain, and that serotonin is the chemical system, and that seems to be the system that is involved in all these anxiety disorders. So what you're going to hear from all these different disorders is really these are the type of medicines that work for this illness. Now, do they work immediately? No. Like in our case, what did I say? It says I said 4 to 8 to 12 weeks. 12 weeks. It takes longer for these things to work for anxiety than it does for depression. Why? We don't know, but it seems to. And you got to give it time. If you give up after 2 weeks, you didn't do the medicine justice. And what you see with improvement is slow, gradual. A slow, gradual improvement. All right. So maybe the panic attacks start to gradually decline. They're not as often as they were. They don't go from 3 to 4 a day, like in this guy's case, to 1 a month overnight, or even in 2 weeks or 4 weeks. It takes a while, for that to happen. These things aren't addictive. They're overall quite safe. They can have, like I said, dizziness or headache or sexual side effects, different things. But what you got to do is you got to decide how much problem is this causing me in my life, this panic disorder, and can I handle some minor little side effect. Most of the side effects, incidentally, go away within the first couple of weeks anyway. So if you can get through the first couple of weeks, you're through the woods there. The other sort of main class of medicines are the nerve pills that work for this, okay? The nerve pills work quickly, unlike the other medicines, the serotonin medicines. They work quickly. They can sometimes have some problems. I mean, we talked a little bit about addiction. Sometimes folks, and the hard part is you don't know who's going to have trouble with addiction until you expose them to the drug, and that's the hard part. Addictions, we now know, is with addiction, your brain is sort of set up for addiction. Unfortunately, we don't know how to know that. I mean, family history helps. I suppose if you have a lot of family history of addiction, then you may say, well, I don't think I should probably take this, or I don't want to try this. Tell your doctor about that or whatever. But these medicines that work quickly like that can sometimes cause addiction, and they have other side effects like sleepiness and maybe making your thinking not quite as clear and that kind of stuff.